Mr. Bloom, a big part of the Affordable Care Act was based on the concept of shared savings. I think you all felt strongly about it. We did. There's bipartisan interest in this. In order to tap the full potential for the concept of shared savings, providers have to know how they're doing. They have to know, in effect, from their patients and the data, in effect, how things are going. And the providers are telling us they can't get their claims in real time. They can't get that information. Now, Senator Grassley and I have introduced, and I think you're aware, legislation to open up the Medicare database. And I think that in order to tap the potential of shared savings, this is another reason for going to support this bipartisan legislative approach. What's your reaction to that? Because I think that if we don't open up the Medicare database, right now it's going to be hard to empower consumers at a time when they clearly want to make choices about cost-effective health care. And my sense is it's going to be hard to tap the full potential of shared savings. What do you all want to do about that? And if you decide today you want to announce support for a bipartisan bill, that'll be fine too.
Not sure I can say that today, but what I can say is that we agree that when providers can see their full claims information, that is powerful. And our feedback from the participants in the ACO model, the bundled payment model, is that for the first time, these opportunities have allowed them to see the complete picture of how their patients receive care and to design interventions. So we are fully supportive and fully share the goal that more information, more data is necessary for these payment models to succeed. They have to be balanced.
The providers, Mr. Bloom, are saying they can't get it now in a timely way.
Sure.
That's the reason I'm asking. So what are you going to do about that?
Well, I think a couple of things. For organizations that come into our ACO program that sign confidentially data use agreements, they can see complete claims information. So working with our models, that creates—
Within what time period? They sign those agreements. When can they see the data?
I believe they receive the data in two different ways. They can receive raw claims versus summary information. One of the other learnings that we've taken from the ACO models and work is that it's very difficult for providers themselves to handle the claims. It takes computer power, it takes infrastructure. So any effort, I believe, to provide that data back must be meaningful, must be easy to understand. The ACOs that we work with had a lot of challenges taking on that degree of kind of zeros and ones in our data. So I think any effort to expand access needs to take into account that data is raw, but it has to be turned to data.
Will you get back to us in writing on the time period
Yes.
when providers can expect to get access to data? Because I asked it a couple times and you didn't answer that question. So if you can get back to us this week on the time period when providers can get that data, because they have to have it for shared savings.
Sure. So one thing to consider for your legislation is that we are dependent on when providers submit the data to CMS. So under current law, I believe they have up to 12 months to submit a claim from when the time is provided. So that's one challenge to timely data. So we need to work through that provision before we can provide that real-time information.
We'll be glad to work with you on it. But again, if we're going to make an integral part of the Affordable Care Act, something I support, I know you support work, and that's a shared savings concept, we've got to have a timeline when providers can get their data, because without that data, they can't really compare it and tap the potential of a concept I know you're for. One last question with respect to the Innovation Center. In effect, CBO has essentially said that savings, any ideas that we now come up with, are already accounted for. Essentially, that is built into the Act for the Innovation Center. I just want to make sure that CMS is clear that it isn't going to have every idea under the sun with respect to holding costs down in innovation, that congressional legislation and other proposals can also be scored, and they won't be held up just because there's an interpretation from CMS that every single idea under the sun is going to be due to the Innovation Center. Can you tell me that this morning?
We are eager for ideas, and we will be happy to work with you in your office to identify new ideas. I can't speak to CBO scoring conventions, but what I can say is we want to find every opportunity to reduce the cost of care while improving the quality of care.
My time is up. I just don't want all of the members of the Finance Committee, Democrats and Republicans, to in effect get boxed in, and when they have good ideas, everybody says, oh, we can't pass that legislation because savings all come from the Innovation Center. So we'd like to follow that up with you as well.
Very good. Thank you.
Thank
Senator.
you.